Hi, my name is Shazmi Khan and I'm a professor of OBGYN. Today we're going to talk about pregnancy and labor. A normal pregnancy lasts about 40 weeks and is divided into 3 trimesters. What are the symptoms which a patient comes to you if patient is pregnant? The most common symptom is the absence of menstrual period. Other symptoms such as breast changes, tiredness, nausea, morning sickness, mood swings, or vague complaints like heartburn are also there. So how you going to confirm that the patient is pregnant? The best way is run a pregnancy test. This test takes the advantage of chorionic gonadotrophin hormone, which is secreted by the syncytial trophoblast. Once the test is positive, you want to know what is the expected date of delivery for your patient. To calculate the expected date of delivery, you need to know the last menstrual period of the patient. There are various methods. One of them is Nagel's rule, in which you add 1 year to the last menstrual period, and then you subtract 3 months, and then again you add 7 days to calculate approximately a period of 280 days or 40 weeks. There are wheel calculators available on the delivery suite, which adds around 280 days, the same which the Nagel's rule does. In our labs, we're going to calculate the normal expected date of delivery for a woman with a normal menstrual cycle as well as a woman with the abnormal menstrual cycle. There are certain abbreviations which you see in the delivery suite, such as GPTPAL. So G stands for gravida, the number of time a woman is pregnant. G2 means patient is pregnant second time, or G1 means the first time pregnant. Para is the outcome of the pregnancy. T stands for the term deliveries, and P is for the prematurity, the premature deliveries. A is for the number of abortion, and L is the number of living children. Now, when we say about the prematurity, we need to know the latest guidelines by the ACOG, the American Congress of OBGYN, which states that the prematurity is less than 36 weeks and maturity lies between the 37 to 39 weeks. The term is basically 39 weeks. Now, we also said that there are different trimesters of the pregnancy. What are those trimesters? What are the duration of those trimesters? So, the first trimester starts from week 1 of the pregnancy and it lasts till week 12. The second trimester starts from week 13 and it lasts till week 28. And the third trimester starts from 29 weeks and it lasts till week 28. So the patients who deliver before 37 weeks, we call them preterm, and those who deliver between 34 to 37 weeks, we call them late preterm. These are according to the new guidelines by the ACOG. The term is then 39 weeks, and early term is 37 to 39 weeks. Post-term is anything beyond 41 weeks. Now, prematurity is a risk to the neonate, so we have to be very careful when we are inducing the patient. These guidelines we need them when we are doing the induction of labor. That is where we put some medications in a drip and we put an IV cannula in the patient's vein so that we can start the labor artificially so that we can bring the baby into the world. Now, what is a full-term fetus like, or what is a full-term baby like? Usually, it's on an average. These are the average weights. On an average, a baby which is full-term weighs around 6.2 pounds to 9.2 pounds, and the length of the baby is between 19 to 21 inches. To tell the date, the maturity and the date based on the ultrasound, during each trimester, you need to know certain big facts. For example, by first week, 4 week, when the first 4 weeks of pregnancy are finished, fetus has developed a heart, a spinal cord, and brain. In week 8, the heart starts beating and the eyes with the eyelids and the umbilical cord, they are visible on the ultrasound scan. By week 12, the gonads can be identified, and usually people they go for the test, to know the sex of the fetus. There are other indicators as well, such as skin start forming in week 16, and the meconium in the gut starts developing in week 16 as well. At that time, you also see the fetus making the sucking motions with the mouth, as is a suckling reflex. The most prominent feature of week 20 is that baby has, or the fetus has, eyebrows, eyelashes, fingernails, and toenails. In week 24, the lungs are formed, but they are still solid. The fetus is inside the liquor amnii, floating in the liquor amnii. So there's no way that fetus can inhale. That is the reason that the lungs are solid. In week 32, the bones are formed, but they are soft. In the fetus, you can see the kicks and jabs, and patient, the mother, can feel the jabs and pokes of the fetus. The eyes now, they can open and close to sense the changes in the light. By that time, fetus has gained enough weight, about 1/2, and the rate of gaining the weight is about 1/2 pound a week. By week 36, the body fat increases and the baby develops the vernix, the outer pale covering the fatty layer of the baby, and it's getting bigger. About now, baby, you can say, is 16 inches long and weighs around 6 to 6.5 pounds. By week 37 to 40, baby may turn into a head-down position for the birth if the baby is going to deliver cephalic, or podalic if the baby is going to deliver in a breech position. Now, what are the problems which are associated with the pregnancy? In the early pregnancy, patient usually complained of weakness and nausea, vomiting. What advice you want to give? Besides these complaints, you want to definitely want to give advice of taking folic acid and iron regularly. In fact, we advise the patient to start taking folic acid when the patient starts planning for a pregnancy. 0.4 milligram per day is the dose. We prescribe it. If there are some indications where patient needs more, we can double the dose. For body pains and aches, we really do not prescribe any medication in the first trimester. For nausea, vomiting, we usually try to advise certain remedies like dry, food and crackers, early morning, fresh air, avoidance of the odors and the perfumes, and to avoid the stuffy air. For ingestion and heartburn, we usually ask the patient to take the plenty of fluid and take the several small meals and healthy meals which lacks the hot peppers and fatty component in the food. There are certain medications which you need to know to avoid in the first trimester, and these are the medications which are labeled as category D or category X. Category A are the safe medications, and they demonstrate no risk to the fetus, and they are easy, you can use them easily. So is true for the category B and C medications. Now, the problems which patient comes to you, the most common is the dizziness. They feel dizzy. The dizziness also leads them to feel tired, and that is because in the first trimester, The vasodilatation secondary to the pregnancy causes the hypotension. And for that, you can advise the patient to take rest during the daytime so that the blood pressure can be maintained on a steady state. And this rest can be increased according to the patient's requirement. You can also advise the patient to take plenty of fluids. Patient also complains of constipation. You can ask the patient to increase the fiber in the diet and increase the vegetables and the salad portions and the whole grain cereals in the patient's food. Also advise the patient to do the physical activities and stretches. Patient complaints of breast secretions can wear the maternity bra and can use the pads to avoid the soaking of the shirts. Patient also complains of numbness and tingling in the hands and arms. You need to check the excessive retention of the fluid, and you also need to check the urine for albumin to rule out the preeclampsia. Carpal tunnel syndrome and sciatica is also seen due to fluid compressing the nerves. Again, you're going to check the urine for the albumin, and you also check the presence of edema. You can also supplement the diet with the calcium so that the leg cramps and those kind of complaints can be encountered. For morning sickness, usually you try to advise more rest, but there are 15 to 20% of the women who keep continuing with the morning sickness, who have this complaint throughout the mid trimester or sometimes till the end of the second trimester. Those women who have mild nausea and vomiting during pregnancy, you can advise them to take more rest and eat dry food. But if the woman who complains of hyperemesis gravidum, not complain, but you detect hyperemesis gravidarum, those women, they vomit usually about, let's say, 5 to 10 times every day and lose 5% of their pre-pregnancy body weight. And you, in these women, you can prescribe the patient with diphenhydramine 25 to 50 milligram orally every 6 hours. Sometimes once a day or twice a day is also sufficient, but the dose is 25 to 50 milligram 6 hours. There are other medications which are prescription medications such as promethazine. If the vomiting is severe, you can use that medication as well.